good description and presented everything, all intricacy of thyroid. But I just want to emphasize that clinical suspicion is very much important. You should think whether it is towards hyperside or hyposide. Because sometimes, recently, one case came to my ward as pain abdomen. He was seen in casualty by residents, by some patients, and because he had pain abdomen, she was admitted in my ward and given some tenderness was there. I given ciprofloxacin, standard pain abdomen, ciprofloxacin IV drip. Ciprofloxacin IV drip standard. So always you think, what I am going to treat the patient. But this patient, if you treat with ciprofloxacin and IV, patient will die. Why I am telling? The patient was around 64 or 65 years lady, female. I have shown to some of the patients also. So she came with pain abdomen. They didn't have any vomiting, temperature was normal. And admitted in my ward. In the evening I saw, when I saw patient was having respiratory distress. Typically, when you ask her name, you can diagnose from the name, from the voice only. The typical case of hoarseness of voice. Typically, if one sees that patient, he will never forget in his life, in his or her life. So the typical hoarseness of voice, pulse rate was 54, mild edema of the feet, puffiness of. If anybody has seen a typical case of hypothyroidism, not hypothyroidism, mixed edema. Then when I examined, BP was, I think, little raised, or I don't know, I remember exactly. And liver was enlarged, chest bilateral crepes. So she was in mixed edema with failure. I did immediately I stopped the IV drip. I admitted all the antibiotics. Did an ECG. ECG was typical of low voltage and bradycardia. So a typical case of mixed edema with failure. So in this case, if you do not keep in your mind that this can occur, then you will give IV drip and patient die of cardiac. If this IV drip has not been stopped, I gave a Lasix also IV. Next morning, you would not have seen the patient. So this suspicion you should keep in mind. And then ECG was done. Then because Somapek was telling T3 was not being done, so I did it outside. TSS was 150 something, 156 or something. Did you कितना था? 150 something. 120 something. And T3 was less than 0.1, and T4 was 3 point something. So my intention of telling this case, you should keep it in mind that sometimes you may get hypothyroid cases, because this is not, I have seen in my career of here only 4 or 5 cases of typical cases of hypothyroidism. You should keep in mind that this can occur, this can come to mind, and only pain abdomen, they can present this only pain. This case she presented with failure, or another 2-3 cases I have seen, old, elderly, only pain abdomen, no other features. Only pain abdomen they can present. So just
and then
keep that high. Then I asked him to see, and he said,
that patient
pericardial effusion also there.
And by that typical voice.
This case.
Voice, because
I called Mohesh also to see. Mohesh na? Kya naam hai uska? She had come, so I.
Next day, then I took the patient to our ward in cardiology. And
kindly call me to record also next time. If such cases come, kindly call me to have the record.
Okay.
Hypothyroid is diagnosed what is telling that
not for
voice,
treatment,
not by the interaction. The teaching is that hypothyroid, a typical myxedema, is diagnosed by the telephone. If you are hurting a patient on telephone, you can say that it is having the myxedema. This is a traditional teaching. What sir is trying to emphasize, because of the severe myxedema over the
clinical points, you should always see the clinical features.
Yes. But this patient we are having hyperemesis, very important. Some facts regarding the hyperemesis gravidarum. Typically it occurs generally in fast pregnancy. Second, generally in advanced affluent society, not prepared for the pregnancy. Suppose particularly there are so many hormonal theories. You are having ACHD theory, progesterone theories, and other psychogenic cause. Why it happens? Hyperemesis gravidarum. The whole hyperemesis gravidarum, if you is equally in medical point of view, that from the emesis center due to high